Hello, my name is Philip Melo, and today we would discuss artificial intelligence in public health. And I would like to share with you some new breakthroughs, some new discoveries that can significantly push ahead public health and public health informatics and technology. Uh, I would like to start with the definition of artificial intelligence. And artificial intelligence, actually, it is a program or a set of programs that can complete cognitive tasks, typically associated with human intelligence. So we do not say in data science, data scientists who work in public health never say that artificial intelligence will substitute human beings. No, but artificial intelligence has a tremendous power to strengthen the decision support systems, to make them more accurate, and to help human beings in public health and healthcare make better decisions and offer better service to our communities and also patients when we talk about healthcare. There are two major tools in uh, artificial intelligence, and one of the tools or components we say it's called rule-based techniques. They do not work with the data, but they work on different rules that specify some actions. For example, rule-based techniques can block spam in your emails. But machine learning techniques, they actually work with the collected data. And our goal for data scientists who work in public health is to get more maximum information from the collected data. That is what we strive to do. Machine learning, the ability of machine learning algorithms to analyze vast amounts of data, the different types, different structures, different formats, and different size and shape of data. For example, we already covered big data in public health in my previous lecture. We built a pipeline in hands-on training, so we know all the things. But that is they identify patterns, generate actionable insight that opened new horizons for enhancing various aspects of public health initiatives. An example is public health surveillance system, which is the backbone of public health. And AI helps analyze diverse data sources, includes social media feeds, very important, perform internet searches, examines electronic health records, EHR, integrates environmental, bacteriological, and other data. Now, there are various groups in this country and abroad. They work on optimization of machine learning and implementation of machine learning algorithms. And one of the examples is application of machine learning to COVID-19. It's a pandemic that was a scourge in the different countries, in many countries, and they affected lots of people, regardless backgrounds, race, and so forth. So our model, that what we developed, is two modules. One is that with high accuracy, using machine learning, can identify can accurately detect COVID-19 cases. And we need for this a few features like sex, age, contact history with infected individuals, and the appearance of 5 or 6 clinical symptoms. The next modules that we developed and we use is the prediction of the spread of the disease, and our model is able to even predict recurrence of COVID-19 in particular areas. And this is quite encouraging. There are other models have been developed during these years, and they show high effectiveness in working with different data, including COVID-19, to forecast pandemics, outbreaks, and so forth. Now, by monitoring and detecting patterns, machine learning algorithms can identify potential disease outbreaks, track the spread of infectious diseases, and forecast disease trends. These insights enable public health authorities to allocate resources, effectively implement timely interventions, and prevent or mitigate the impact of epidemics. That's what we learn from our recent experience show, not only our, but in data science, working in public health informatics and technology. I just would like to remind, because in the previous lectures we discussed this in more detail, but I just remind you that there are different data sources in public health. There are multiple data sources that makes actually the work on public health data quite complex, and without help of machine learning, artificial intelligence, we understand that sometimes it's very hard or even impossible to reach accurate results. So we specify 4 categories of data sources in public health. The first one is we call D. So these sources, it stands for disease. Data include data from healthcare providers, hospitals, insurance claims, very valuable source of data, insurance claim. This includes electronic health records, EHR, disease registries such as cancer, diabetes. They provide detailed information on the incidence, prevalence, and treatment of these conditions. Then we have a letter H. H stands for host or health. Host and health includes health surveys. We use in data science, in public health informatics, we use behavioral risk factor surveillance system, among other systems. We use National Health and Nutrition Examination Survey, very valuable, NHANES, that collect data on health behaviors, conditions, and risk factors in the populations. We use a CDC surveillance system for infectious diseases and chronic conditions, census data, vital statistics, and so forth. Then it goes E, it's environment. So what we learned from COVID-19, that environmental data, they plays a crucial role for accurate identification of disease and its spreads and prediction. And environmental monitoring data includes data such as air and water quality, toxic substances, climate condition, air pollution, very useful, very important data that actually in some extent determine the spread of the COVID-19, for example, and other diseases. Then we have SM. SM consists of 2 elements. SM, it is first of all, it is information from community health assessments. Also includes the demographic data, income, and so forth. We call it as SDOH. It is social determinant of health. And we have social media. Social media is now one of the hottest topic, and we learn, and we now got experience to work with social media and to extract data. Not only extract data that we use also for our algorithm, but also social media platforms are crucial for disseminating health information and raising public awareness about health issues. So social media appears to be quite useful tool that we use. Now, before going to the recent breakthrough that can actually boost the use of artificial intelligence, that make the data processing much easier and more accurate results. This breakthrough we'll talk in a few slides, but now I would like just to remind you that AI plays a crucial role in data integration, because we have all these data sources that we discussed. It is D, disease, host and health, E, environment, and SM consists of 2 elements. So the data comes from different sources and comes with different structures. Sometimes data are structured, semi-structured, or unstructured, like text, for example. Then we have different types of data formats and so forth. So the one of the major elements of our work in public health informatics is to integrate these data, and we also covered this in my previous lecture when we built a pipeline that does integration and not only does integration but process data in real time. Okay, now in terms of AI, that it plays a crucial role in data integration for public health by enhancing disease surveillance, personalized health intervention, and public health activity. That is what we can do if we know how to integrate the collected data. In disease surveillance, AI uses advanced algorithms like deep learning to analyze large data sets. We already covered deep learning, and I showed how we can optimize this procedure. It gives accurate results by choosing various parameters for deep learning depending on your use case. And we included also social media trends, healthcare records, environmental factors to predict disease outbreaks and their potential spread. So this is quite important. Then we are just moving ahead, and we're entering a new era, which is called personalized health interventions. And AI can tailor health education and preventive measures to individual needs by analyzing individual health data. This refers to healthcare, refers to personalized care for patients, yeah, and also to personalized public health. It is a new era that we are entering, and this is very exciting. And we already developed various algorithms for personalization, and we are just testing them. We try to improve them and so forth. But this is the one step in the future. So this personalization extends to risk assessment, where AI algorithms can identify the individuals and populations communities at high risk for certain conditions, enabling early intervention and more effective management of diseases. Now, public health epidemiology. AI improves the discovery and insight by processing and analyzing complex and large-scale data sets, uncovering patterns and associations. This is particularly important in epidemiological studies and understanding the social determinant of health, where multifactorial influence converge. So we also covered the fundamentals of epidemiology and statistics. And of course, we showed that machine learning, artificial intelligence play a decisive role in better data collection. And we'll talk about this in a few slides. And when I would like to share with you some new ideas, some new discoveries in AI. So here I would like also to underscore the meaning of personalized medicine, personalized public health, because sometimes it's called precision or individualized medicine and public health, is an emerging field of medicine that and public health that uses diagnostic tools to identify specific biological markers, often genetic. So we also include this in the disease to help assess which medical treatments and procedures will be best for each patient. When we talk about public health, we talk about population, personalized population. Now, there is some challenges, and I would like to underscore these challenges. There are two major challenges that sometimes make AI as difficult or even impossible to apply. So first challenge is that many healthcare institutions in the United States and in other countries, they operate on legacy systems. and these legacy systems are not compatible or not easily compatible with new AI technology. Basically, what from our experience, it follows that organization we call SDOH, it is Social Determinant of Health, they have some difficulties to accept new technologies because of the system, and also they have difficulties in terms of data interoperability. Some of them, they do not have means to send and receive the data. So this is a challenge, and this challenge should be taken seriously, matter, and it should be alleviated. Then another challenge, very important, is the quality of data. There is a theorem in data science that it doesn't matter what kind of algorithm you are using, but if the data quality is poor, you will never get a good result. So this is a theorem. I would just to say that if, for instance, you invited your friends for a dinner, but you found out that the meat, for example, that you have, or vegetables that have spoilage, not fresh, you will never offer these products in terms of, let's say, dinner to your friends, of course, because you know that it doesn't matter how you cook it, what is kind of ingredients you put in there over that, but still there is spoilage in food, and the results, the dinner won't be so acceptable, of course. So the quality of data is number one, because artificial intelligence requires excellent data quality. Of course, we know, and we already studied that. You remember we discussed all these five ingredients of preprocessing of data preprocessing, which include, for example, elimination of outliers, how we work with incomplete data, noise, feature engineering, data normalization, standardization. So we know these things, but the problem is that now we have a very interesting and important breakthrough instrument that may be very, very useful in our work. And exactly now I would like to share you with these ideas, because we just working on that, and it is just we have preliminary results, very encouraging, but it is still we can name them as ideas. And this one is I will just skip this slide because we already discussed this. Is real-time data processing, integration with multiple data sources, and specifically, for example, when we work with IOMT, it is Internet of Medical Things, different devices. It requires, of course, real-time processing, and predictive analytics is actually a very exciting area. It is we will discuss it separately. That will, of course, that represents the most very interesting, very important element in public health, informatics, and also in healthcare. But I will just show you some new ideas that I would like to share with that actually would shape the whole may shape the whole idea of public health informatics and healthcare informatics using artificial intelligence. This one we call GenAI. So GenAI is a new technology that is different from conventional AI, because what we do in conventional AI, we collect data. We collect data from four categories, as we discussed today. But the problem is that the data, sometimes raw data, comes to us with poor quality. And it doesn't matter what we do, how we pre-process these data. Sometimes it's very hard to get accurate results. And to get accurate results affect the decision makers they can make not optimal decisions in terms of monitoring, let's say, disease spread and outbreaks. So what actually Gen AI does? Gen AI is not actually shows us the ways to, let's say, to process the collected data. It is generate the data. Therefore, this is word generative AI shows that this actually generate data. And when we use Gen AI to the data that we collected, it will generate data, and we have some algorithms now that we are testing that actually improves the data, considerably improve the data. Okay, so Gen AI is this type of artificial intelligence, uses various models and techniques to generate outputs that are often indistinguishable from those created by humans. So it creates also, it can create images, it can create text, even computer codes. So Gen AI is a new ideas, new, it's a great step ahead, it's a leap ahead uh, in public health, also in health care, because this generates new data, and we now start to understand how we can use Gen AI to significantly boost the quality of the data and to get more information of that. So there are unlimited possibilities and unlimited application, not only in public health and healthcare, but it also in engineering, in finance, and so forth of Gen AI. And one example is ChatGPT. ChatGPT is already has been developed, and we actually use it. It is part of large language models, LLM, and they trained with massive amounts of data to accurately predict what word comes next in a sentence. So this gives intelligence, for instance, to make text which is intelligible. And this is extremely important, extremely useful in healthcare and public health. And therefore, it was discovered that increasing the amount of data increase the ability of the language models to do more. So this is, we talk about language models, but actually now we start using Gen AI in generation of public health and health care data, and improving with this one, improving our AI models, because we know that the more data we put in the our modules, the better results we have. So that is obvious results, but we were actually surprised how we can actually improve the accuracy of our models using Gen AI together with conventional AI in real time and in conventional processing when we work with batches. Okay, I finished for today, and thank you for your attention. So next time we will be talking about how AI can be used for in nursing practice, and also in for health provider doctors and nurses. And I will show you some also interesting ideas and some examples of this work. Okay, bye-bye. Thank you.